what are tuberculosis and drug-resistant tuberculosis? So tuberculosis is a bacteria, often affecting the lungs, but can affect many parts of the body. And there is something called drug-resistant TB, where some of the drugs that we normally use for TB are not working anymore because the bacteria is becoming resistant. What are the symptoms of TB? So this is one of the problems. So early detection of TB is quite difficult because people often don't have any symptoms. When they get sicker, they often have weight loss, night sweats, fever, and a cough. How do you test for TB? So if someone came with those symptoms, we'd usually do a test on the spit from deep in the lungs. And there's a test called the Gene Expert that is very good at picking up whether someone has TB and whether they're resistant. There are issues just in that test. It costs money, and in a lot of places that MSF work, we don't have access to that test all the time. How is TB treated? So if you have relatively straightforward TB that's susceptible to all of the drugs, we can use some antibiotics, usually for 6 months. Unfortunately, there are a rise of cases that are resistant to that, so that needs slightly more complicated treatment. What I want everyone to remember is that TB is definitely not going away. It's curable, but access to those medications and that treatment are really important, especially in some of the places where MSF is working.